January 26th meeting of the Board of Commissioners Finance Committee to order. Would you please call the roll?
Yes. Chevelle.
Here.
Eileen Colwell is absent with notice. McGilvray.
Here.
Tracy holding things
Howell
close to the vest.
is absent.
She is, huh?
Oh, there's Kowal right there.
Okay, here she is. Looks like Powell is absent with notice. Charles.
Present.
Long is absent with notice. Moss.
Here.
And Markham.
Here.
You have a quorum.
Great, thank you. Let's rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Radio days.
I know. Next up, we have approval of the January 12th minutes. I need a motion. Commissioner McGilvray, supported by Commissioner Kowal. All in favor? Excuse me, say aye.
Aye.
Excuse me. Opposed, say nay. Minutes are approved. Next up is approval of today's agenda. I need a motion. Commissioner Charles, supported by Commissioner Cavell. All in favor, say aye. Aye. Opposed, say nay. Okay, next up is public comment. At this time, we welcome anybody to speak on items on the agenda. You have 3 minutes. Anybody want to speak? Is that a yes or a no over there? Okay. Good morning. State
Good
your
morning.
name and your location, where you live, please.
Morning, Commissioners. I'm Catherine Kennedy from Lake Orion, and I actually have not had a time to review the full agenda. I did download it this morning. I wasn't up yesterday, but there's a couple of items I noticed. That the contingency report on Communications 7C, a little confused. Apparently, there's 116 that got transferred for budget amendments at year end. I think that it was the changes that had happened in the December 9th meeting. There were a whole bunch of pages for the audit changes, so I'm assuming that that's what that relates to. I do have a couple of questions on the FEMA. I actually heard a report this morning that FEMA is actually being used to pay for the flights for the illegal immigrants that were let loose all over Texas this morning. They've got it documented with video. Most concerning is the fact that it isn't families at all. It's a bunch of single men, and this was video documented. So I know most of the news won't tell you those things, but I'm board retiree, so I actually follow quite a few different sources of news in multiple languages, actually. So I do get different information than I'm sure some other people do. I just wanted to make sure you're aware of that. I'm not sure. I know there were 2 different FEMA proposals. One or the other was supposed to go, but I don't even know the difference between one or the other, or if this is actually part of what they're doing, like the raise the age, which is what I suspect they may be using for the illegals that have criminal records. It is very concerning that the exact same dollar amount might be just coincidence. $750,000 was the amount of the raise the age grant that was done by communication only. And there was a financial report year end that had a single line item for translator fees for SCOW, which I believe is the court forum company. So those are things that I actually would like investigated before conclusions are done. I really would like to see more than a few hours notice for the citizens to actually see what's going on in the county. That's one of the things that bothers me the most, is that it's like they're trying to do things before we catch on. That's how it feels. I know that I'm sure that's not the intent, but that is how it feels. And on item 9A, I see that is actually on this agenda also. It was for the earlier meeting. That was the resolution appropriation of American Rescue Plan Act for the 2022 Winter Blast Royal Oak Festival matching grant. I actually did a comment about that specific item, which was at the meeting at 9:30, just preceding this one, because the packet that I downloaded at 7 a.m. this morning for the meeting at 9:30 this morning did not have any attachment linked to that item in the meeting for 9:30, and I see it carries over into this meeting.
Thank you. Your 3 minutes are up, Ms. Kennedy.
Thank you very much.
Thank you. All right. Is there anybody else who wants to speak in public comment? Seeing no one, I will close the first public comment, and we'll move on to communications. I need a motion to receive and file the communications. Commissioner Kowal, supported by Commissioner McGilvery. Anybody have any comments or discussion on any of these items? If not, please prompt the vote.
Oh, I have something to say. My bad.
Go ahead.
Thanks. Just interesting to note the, I think it was item D in the communications about how much of the county's ARPA money has been expended. So we ended up 10 million, or assigned 10 million and have spent 7.3 of it so far.
Right. And that's specific to county operations.
Yeah.
Yes. Okay. Next up, we have item number 8.
Need
Oh.
to finish the vote.
Yes. Sorry.
That's okay.
Did everybody vote?
Yeah. 6 yeas, 0
Thanks.
nays.
Good at math.
Thank you. Motion carries. Communications are received and filed. Item number 8, Public Health and Safety Committee recommendations. First up, we have item A, with the Michigan Department of Treasury for the fiscal year 2022 first responder training and recruitment. I need a motion. Commissioner McGilvery, supported by Commissioner Charles. We have with us 2 people from the Sheriff's Department, Under Sheriff Childs, and I don't know your exact title, Gaia, but
Gaia, Sheriff Fiscal Officer.
Fiscal Officer, okay, yes. Nice to have you this morning.
Thank you.
Okay, so when I hit this item, I'm getting a message that page is not available. Maybe I just hit it wrong. Okay, well, why don't you go ahead and tell us what this is?
Okay, so good morning. This is a grant application for $79,570 to upgrade our Vertra simulator. This is a training tool that provides real-life simulation of police incidents. This tool was really useful during the pandemic as we were tasked with having smaller training classes and 6-foot separation or 6-foot social distancing. We use this simulator a lot more for training activities to be able to provide, kind of smaller group and one-on-one training. So we're hoping that we get this grant funding to go ahead and upgrade and update the simulator technology.
Okay, is anybody else having trouble getting their page up?
Yes.
Oh, okay. Commissioner Kowal.
Thank you, Madam Chair. This is quite intriguing, this new simulator. If we could maybe see an example of that one of these days, that would be great when you do get this grant.
It's not new, but if you want to do it, I think Commissioner Cavell has done it, and so.
But I think it's more, isn't it more realistic type?
Yes.
Yes.
that you're doing now.
Yeah.
So
it's a video screen,
It's
and
more
it is very.
real actor kind of thing, so
Yes.
that sounds interesting. Also, the question is, you mentioned 900 sworn officers, so I take it you are also training the local municipalities as well?
Yes, when
Okay.
they ask for assistance or they ask to use it, then they do come in. But I think Commissioner Cavell could probably give you
okay.
an update of that. But anybody's invited. I mean, I think
Okay.
we've always invited everybody to come and take a look at it, make an appointment with our training unit and look at it, and it's really, really interesting.
sounds like it could be fun, but it sounds like maybe I could look really stupid doing it. I don't know.
Well,
It could
I
go
didn't actually
either
do
way.
it, but just watching somebody else do it is really, really interesting to see a real-life scenario and what, as you're standing there, you think it's a routine traffic stop or a routine something, and all of the things you have to pay attention to and what you have to notice, what you have to think about and make a split-second decision is really interesting.
It would be
thank you.
similar to a shoot, don't shoot kind of a situation. in a range.
Yes.
Yeah.
Yes, sir.
Yeah, and then you have taser and weapon, obviously simulated, but yeah, and then they can replay the scenario and show you what happened, what maybe you saw, what you didn't see, what was in the corner over here. I would highly recommend it if you have a chance to go over there and look at it.
Yeah, if I could say something about that. It's also good in learning about bias, right? So I learned from doing one of the scenarios that
Thank you.
I have a bias assuming that a woman who's putting her hands up saying I don't have a gun may actually have a gun, because in the scenario they ran, I stopped looking at her and then she was the one that got me. So,
Oh,
yep. So there's all sorts of different things like that. That's just one example.
Don't trust women.
No, I don't know about that.
And then
Your
I'll say,
reputation precedes you. Sorry.
It's not as easy as you think.
Okay, so that's it, Commissioner Kowal, you're done? I'm sorry, I was distracted, my computer went weird. Commissioner Charles.
Thank you. So Commissioner Cavell asked about biases and things like that, you know, you might have as an officer, and so that'll help to kind of navigate that. I'm curious, and again, I probably watched too much Texas Ranger, I forget the name of it.
Walker, Texas.
Yeah, Walker, Texas Ranger, where like the cops chase guys down and, you know, fisticuffs a little bit. Is that a technique of modern day police law enforcement? Like, obviously that can't be simulated training for those types of things. But I'm just curious, is that more TV, not so much real life in terms of, hey, stop, and then, you know, there's a foot race.
Oh, no, that's real.
It's real?
Yes.
Okay,
Yeah.
okay. Thank you. That's all I wanted to.
Anybody else? Want to go ahead and prompt the vote on item 8A? Thank you.
I have something different.
Okay.
Charles, we can do a voice vote on that.
Yes.
6 yeas, 0 nays.
Motion carries. Thank you very much. Next up, we have item B, appropriating funding for a contract with Wellpath LLC to provide medical services at the Oakland County Jail. I need a motion. Commissioner McGilvery, supported by Commissioner Charles. Good morning again.
Good morning. Yes, we're asking for the approval for the Wellpath funding. They've been instrumental for us, especially during our COVID time that we're going through. I can't say enough about our healthcare services administrator, Vicki Warren, and her ability to help us knowing the system. She was actually a sheriff's office employee and a county employee prior to us switching over, and we're asking for this funding to be approved.
Commissioner Kowal.
thank you. I noticed that you were required to provide your current population, but then also the pre-COVID population, so they could consider both. But did we get any considerations for the fact that our population is considerably lower right now and into the foreseeable future?
Yes, actually, we had 3 scenarios. We had a lower, a middle, and then the max population. So we had 3 proposals, and we actually settled on the one in the middle, which is probably maybe a little bit low, but right about where we're at right now, because obviously, you know, our contract was pretty consistent for the first 8 years because our population was very stable. That's where we saw about a 3% increase each year. And then with this one, we knew we were going to have to change our whole business model because obviously everything's changed with the lesser number of inmates. However, that didn't make anything necessarily easier on the staff. There were obviously with the quarantine, COVID protocols, COVID testing, all of that kind of stuff, and the complexity of the inmate medical needs. That we didn't see really any reduction in. I can give you some other highlights of the financials. if you want. I gave up.
No, I
Okay.
do have a couple other questions, I
Okay.
guess. Well, it did say also that because, like everybody else, help is hard to come by these days, and
Absolutely.
that's kind of driven up costs there.
Mm-hmm.
I was just curious, does everybody that comes into the jail, do they go through this health screening when they come in? If they're just like in for a DUI, they have to sit in the night in jail until they're either post bond or they're sober enough to get out? Everybody that comes in gets this full evaluation?
It depends. Everyone who's there we have to see everybody within 14 days. They've been targeting and reaching that target of about 8 days. So if they're in jail for 8 days, yes, they'll be seen by the clinic. If they come in and they're only there for 2 days, unless they have a medical issue, they probably wouldn't be seen. But anyone who comes in with a medical issue would be seen by the clinic. So it really depends on how long they're there for or if they have an immediate medical need.
Okay, thank you.
Commissioner McGilvery.
Thank you, Madam Chair. How long have we been contracting out these medical services? I know at one time we had a doctor that was there at the jail,
Since 2012.
2012.
So years and years ago, it was part of the nursing staff and the healthcare professionals were part of the health division, and then, but located in the jail. And then at one point in time, I think 2005-ish, is that what we, 2005, then they transferred to the sheriff's office. And then in 2012, then we began contracting with Wellpath.
Yeah, I remember taking a tour, and there was a dentist that was on staff part-time,
Right.
as well as doctors, and I was just curious how long it's been.
Yes,
Okay, thank you.
12.
Thank you. Commissioner Cavell.
Thank you, Chair. Yeah, to what you were saying, Commissioner McGillivray, I'm going to vote no on this because, right, the contract has been the same since 2012. So I think, it being time for a refresh is here. And I understand that when you did the bidding, there weren't other people that were comparable to this, but just noting that. And then second, right, you had mentioned yesterday in public health and safety, there is a cost difference to having it be in-house versus Wellpath contract. However, in my mind, that seems somewhat negligible. And also, right, the cost versus quality argument there. So, just register that.
Thank you, Commissioner. Anybody else? Commissioner Charles.
Yes, my comments are actually to this committee and to the chair, because I'm going to support this because I've had to be in situations where we've had to have outsourced help. I remember when our school bus drivers used to all work for Southfield Public Schools, and that wasn't fiscally sustainable, on and on and on and on. So, of course, I'm going to support this, but my real concern is that the item summary speaks to a budget amendment. And, I'm not one to just do activities just to check something off on a strategic plan box. Because last year, when we asked all of these departments to take these various cuts, quite frankly, it didn't make sense to me. But I was new and felt like, let's just keep going and see where it gets us. But here it is January, and we're already having to do budget amendments. So as we look towards the upcoming fiscal, because I guess we do them in 5-year batches or something like that with our budget, I just don't want us having people spend hundreds of man hours to find ways to cut and then be back in 2 months to say, oh, by the way, we need more money and therefore a budget amendment. It's just a waste of our time as a committee. It's a waste of their time in all of these various departments. This is just how I look at it, whether I'm accurate or not. So again, it's a 3-year contract cost because of insufficient funding at the OCSO to the tune of about $2.2 million for the 3-year period. So again, just saying, let's be pragmatic, but if we're going to amend budgets that we've just taken time to reduce, it's just a waste of time, and I just don't see how that's a value add to the community. So that's my comment. Thank you.
Thank you, Commissioner Charles. Anybody else? Well, one more time, Commissioner
So
Cavell.
what you're saying, Commissioner, if these people were in-house staff, they would be part of that budget reduction, but they're not. They're a separate third-party contracted company. And so they kind of have us at their whim, especially when, based on what the RFP that came back, there were 2 other competitors or whatever that didn't provide as comprehensive an offering as this. And so if they were in-house, we'd be able to do that budget cut or manage those costs a little bit more And that might just be in light of the post-COVID, inflation stuff. But just saying that, what you're saying.
Gaia, I'll ask you, you're the fiscal services person for the sheriff's office. Do you want to address this question at all about why we had to do a budget amendment?
Sure, and obviously, so it's more of a timing thing because this went out to bid, so the budget was last spring is when we submitted our cuts and had to go through and then had budget hearings in the summertime, and then obviously it's adopted in September. This went out to bid in October. Obviously, we were hoping it would still come in and fit within our line item, and unfortunately it didn't, and we're looking at a 7% in staffing. That's where the largest increase is, and obviously that's a nationwide problem. So even during the budget last year, we wouldn't have been able to predict that. So it is unfortunate. And then I would like to address Commissioner Cavell's point too. So if you remember, we were here in October when this item was removed from the budget as one of the professional services that was included in the budget book. So at the budget adoption meeting, there were several professional services contracts that were removed for separate consideration. We were already in the RFP process at the time, so we came to the committee in October and gave an update about, hey, we're out for bid for medical services and it's in process and we're evaluating the bids that we got back. At that time, Chair Woodward had asked if we had considered doing in-house again, and so I went back and did research. And the interesting fact, like we said, we started contracting in 2012. I pulled a jail clinic report. Our 2010 actuals, which is obviously 12 years ago, were $6.1 million. So obviously everything's not apples to apples, but when you look at that in terms of now we're in 2022 and we're looking at this large increase, and that's $6.5 million. If we would have the inflation and have the salaries and have everything that we had from our in-house staff from 2010, I'm assuming it would be much, much higher, so.
Thank you. Commissioner Kowal?
Thank you, Madam Chair. This is what happens when I write down questions and leave them home. As far as coverage when a person is incarcerated in a jail, I read somewhere that Wellpath will bill Medicaid for coverage, so they are covered under Medicaid. And then also, if someone has, the personal health insurance, I'm assuming that gets billed as well? Or are they covered under? I don't know.
That question was asked yesterday when I actually found out the information. We do ask about their private health insurance, and we give that information to Wellpath. They will try and bill it, but my understanding from them is that most private insurances will not cover once you're incarcerated.
Okay.
Okay, Commissioner Moss.
Thank you. Just to throw out to the committee is that it seems there are a couple of things going on. And one is that the budget, for particularly the Sheriff's Department, excuse me, and some of the other larger elements are always kind of a work in progress. There's always things going on, and it's not like you say we passed the budget and this is it, and it must never change for the next year. Things will come up and things, there'll be variances one way or the other. And that's why they come in for oversight, and that's they come in to explain why and how it happens. And so it's good to have the scrutiny of the committee on this item, and it's very good to ask these questions. But the fact that they are doing it is not in and of itself an indication of budget weakness or incompetence or anything. This is just kind of the nature of the beast. That's why we always bragged that we had a rolling budget, and that if changes were made, we would then cost it out for the next 3 years into whatever, and roll that back in, because it's constantly changing. Whether you have what we used to call Lansing negative supplementals or supplementals. And it's constantly kind of being recalibrated, and it's perfectly. It's the way it's supposed to work, is that you come in like this and questions are answered. Another factor, unfortunately, is that those of us who are older remember the 1970s and the period of inflation, which it's starting again. I'm sorry, but it is. And there's no way it can be denied. And for those of you who were fortunate enough not to have to live through it, congratulations, you're going to learn it all over again. and that, you know, as long as you get into the, gee, buy it today, it'll be more expensive tomorrow. Going to the store and saying, wow, I could buy all this last week and I can't this week. As long as we don't start baking it into contracts with cost of living and getting it baked into, which is the very devil to get out, which is why we had those horrible recessions in the early 80s to wring that out and make the money stable value again. But yes, we are going to be getting requests to raise budgets because to keep the same level of services that we had even last October, we are in now an inflationary period. And maybe we can nip this in the bud and maybe we can't. I don't know. But this is going to be something that we are going to be living with, and it will not end happily. But there it is. Okay, so like I said, I'm prepared to support this. But thank you.
Thank you. One more time, each of you, and then we're going to move on
Okay.
because we have a big agenda still.
Okay, I just wanted to.
Commissioner
make note-
Cavell.
Oh, sorry. I just wanted to make note of what Gaia said, that since this was pulled from the budget, this is also on us, especially us in the majority for, you know, I think we all said, we're going to figure this out and get to the bottom of it. And then it showed up, you know, a couple weeks ago and we went, ah, shit, we didn't do this. So we have to be mindful of doing our homework. Just, you know.
I wouldn't characterize it quite that way, but yes.
Okay.
Commissioner
I think
Charles.
that's out of order.
Thank you, Madam Chair.
I say it.
I'd just like to affirm
It's the first time I've ever said it.
this Wellpath company isn't currently in any, I'm trying to say this in the legal best way. Yes, well, there's nothing that, as far as you can attest to, that would cause us to, Wellpath hasn't erred in any way that might cause us to be on the hook for any kind of lawsuits moving forward that you're aware of. In other words, they haven't hurt someone or misidentified an injury or anything like that that might, you know, just be something we would want to know before going into another contract with them.
I can't speak for the whole company. I know
Just for
for our staff,
Yeah.
they do a phenomenal job.
Okay,
Mistakes happen, but it's never intentional. They do a phenomenal job.
okay, that's all I needed. Thank you.
Commissioner McGilvery.
Sorry to prolong this. Just one quick question. I noticed that Wellpath is from Nashville, Tennessee.
Yes, that's our
We
corporation.
didn't get any local bidders from Michigan?
I don't know if there are any available in Michigan, but in the October meeting, Scott Guzzi was on the Zoom call and basically said nationwide, there's really 3 large companies that provide this service. Wellpath, actually, we used to, I think originally it was Correct Care Solutions. Wellpath bought them out. So we actually got bids from 2 of the 3 that are eligible for this. And like I said, I don't know that anybody is actually local in Michigan that provides this service.
Okay, thank you.
Okay. Going once, going twice. Let's prompt the vote on item 8B.
We have 4 yeas, 2 nays.
Okay, motion carries. Next up, we have item 8C, approval of an interlocal agreement with Macomb County for the 2020 Homeland Security Grant Program. I need a motion. Commissioner Charles, supported by Commissioner, somebody raise your hand. McGilvery. Got it. All right. We're getting a lot of feedback from your microphone. Mr. Seeley, I think?
Yep.
Okay. I think we're better now. All right. Good morning.
Good morning. All right, so this is a grant acceptance and approval of an interlocal agreement between us and Macomb County. This Homeland Security Grant Program has been in existence since 2006. This year, the total amount of the grant is $815,709. Of that, $39,376 is in one grant pot. $536,333 is from the UASI region, the Urban Area Strategic Initiative, which is 7 communities here in Southeast Michigan. And then the additional $240,000 is for paying the salaries of our 4 grant-funded employees, which are 2 solution area planners, which we have here in our office, and 2 people from the DSEMIC, who are intelligence analysis analysts who actually work for the sheriff's office, but the money flows through Homeland Security for those positions.
Thank you. Anybody have any questions on this item? I'll open it up to the commission, committee. Seeing no questions, I'll go ahead and prompt the vote.
We have 6 yeas, 0 nays.
Thank you. Motion carries.
Thank you, Commissioners.
Thank you. Next up, we have, I got to get back to my agenda. Item 8D, with the Federal Emergency Management Agency, FEMA, for the Building Resistant Infrastructure in Communities Grant. Need a motion? Commissioner Cavell, supported by Commissioner McGilvery. Good morning, Mr. Hardesty.
Good morning, Tom Hardesty on behalf of the Emergency Management Homeland Security Department. This is the first of 2 grant applications in front of you this morning. They're both actually for the exact same thing, just 2 different buckets of money, for lack of a better term, from FEMA that we're seeking this. So last year, you may recall, the board approved a feasibility study for some new buildings, one of which would be a new Emergency Operations Center and 911 Dispatch Center. So we've been seeking opportunities to try to offset some of those costs for the county. This is a grant request that would, if approved, would provide $435,000 from FEMA with a $145,000 county match that would come from funds already approved for this project. And this grant would pay for the costs as we look at design, pre-design, construction plans, all of that. This grant would pay for basically the difference between a building and a hardened facility. So all the costs related to the planning documents, design documents that would look at the differences between those 2. So part of the reason for this request coming at you at a late time, these grants all go through the state. Initially, the state was looking at it and telling us to apply for this grant, the BREAK grant. Then they pulled it back and said, well, no, apply for the next one I'll have in front of you. And then they said, well, no, apply for both. And then we'll see which one that the feds might approve. And with that, I can answer any questions.
Okay. Anybody have any questions? Seeing none, I will prompt the vote.
We have 6 yeas, 0 nays.
Excellent. Motion carries. Thank you, Mr. Hardesty. Next up, we have item 9. Well, that was 9D, right? Do we have to, we have to vote on each of them separately?
Yeah, E, flip your page over.
Okay, yep. So now we're going to go to item 9E, which is basically the same thing, but looking for a different bucket from FEMA. So I need a motion, Commissioner McGilvery, supported by Commissioner Kowal. Okay. Let's go ahead and prompt the vote on item 8E.
Cavell?
Yes.
Thank you. We have 6 yeas, 0 nays.
Okay, thank you. Motion carries. All right, next up, we have item 9A, under the Economic Development and Infrastructure Committee. Board of Commissioners Resolution Appropriation of American Rescue Plan Act Local Fiscal Recovery Funds for the 2022 Winter Blast Royal Oak Festival Matching Grant. I need a motion. Commissioner Moss, supported by Commissioner Charles. All right. Do we have any discussion on this?
Sure, Madam Chair.
Commissioner Charles.
Just restating what I said in EDI, which was simply that if we can just practice what we preach, making sure that if we do expend help funds for this activity, that we're promoting good practices with regards to COVID-19. I mean, the virus is still very active, and so I am very happy that 85% of this is outside. I mean, I'm not new to this area, so I know what the winter blast is, but just making sure that they have stations for getting their hands clean, little things like that go a long way, especially when you're outside. So I supported it last meeting, and I'll support it again, but just wanted to make that recommendation. Not recommendation, just that statement.
Thank you, Commissioner. Anybody else? Okay, let's go ahead and vote on item 9A. Prompt the vote.
We have 7 yeas, 0 nays.
Excellent. Motion carries. Thank you. Next up, we have item 10. Under department recommendations, first we have information technology contract, IT-related Blue Hill contract renewal. And I see we have Mr. Tim here today. Thank you.
Thank you.
I need a motion. Thank you. Commissioner Charles, supported by Commissioner Kowal. Good morning, Mr. Tim.
Good morning, Commissioners. Happy New Year.
Thank you. It's still January, so you can say that.
So, yes, I'm here this morning. This particular contract, this is a contract extension request. Our mainframe was outsourced from a service perspective more than a decade ago. So we no longer have a mainframe in our data center. We outsource that service partly because mainframes from a technology perspective are becoming obsolete. New types of hardware and architectures, and also the support software, all of that infrastructure is very, very old and very hard to support. So there are some companies, the company that won our RFP is called Blue Hill. They are a market leader in this space. We do research through Gartner, who is an IT consulting company. We actually do Gartner research on almost every project we do in IT. And part of the purpose of that is they evaluate the capabilities of these providers. They do this with hardware, with software, various applications. When we did the Workday RFP, we did a similar type of analysis. And the Blue Hill organization consistently is in the top in terms of their ability to support the operation, their ability to think strategically as much as they can with this hardware platform, and their cost competitiveness. So that was part of the factor, in addition to the bid evaluation that we did, that they won, and we have been using them. The primary application that is on the mainframe, the reason we cannot yet get rid of it, which is absolutely part of our strategic plan, is the court's case management system. We have dozens of judges in the circuit court, the district courts, the prosecutor's office, the clerk's office, are all using this large system to manage the hundreds and historically thousands of cases that come through our court system that we support here at Oakland County. That system is in the middle of an RFP. You may recall there have been resolutions to bring, there's a project manager now on staff in the courts team. That project manager is working closely with IT to build the RFP. The RFP will be akin to the Workday project once that gets released. We did just finish an RFI last year. The RFI helped us build some of the requirements that are going into the RFP. That RFP will go out to bid in the next few months, and the project to replace the case management system is expected to take several years. And it will be multi-million dollars. That will include new hardware infrastructure. Will basically replace the mainframe. But until then, we still need to operate the existing system for these departments. Again, it is a critical piece of our infrastructure, and it's not something that is easily migrated to another provider. So we do have this, if you'll recall, in my November, or was it December presentation on the procurement process in IT. This is one of those items that is listed as one of those strategic pieces of infrastructure because of the criticality to the county and also because of the cost of change for this. And again, it's a multi-million-dollar project to replace it. So we are requesting the extension for this particular contract and this vendor for another 5 years. We hope to be done before then with the replacement of the case management system. But as that still has not been bid out yet, we're still in a TBD with that. So are there any other questions I can answer?
Thank you. Do any of the commissioners have any questions for Mr. Tim? Commissioner Cavell.
Yeah, thank you, Chair. I have two questions. One, you might have been mentioning this, forgive me if I missed it, but why is it a 5-year contract instead of the standard 3 years and then 2 possible renewals?
We still have the option to cancel at any time for any reason. That's in our standard contract. We could do the 3-year with the extension option. It's just at this point, the 5-year option gives us the safety net, if you will, for the project.
But don't all contracts have a contingency that say you can cancel at any time? So like
Almost all, yep.
Yeah. So then this is just kind of like, because you can, you are? That's what I'm hearing, if I'm not mistaken. Because you can push a 5-year contract, you are going for that.
We're just expecting that 3 years won't be long enough to replace the case management system.
Okay.
We don't have that RFP done yet. But again, given the Workday project and the scope of the case management system in the county is so significant, we believe it'll be more than 3 years.
Okay. And then the second question was kind of to what you were saying. So you don't know when the court management will be done, but you're predicting longer than 3 years.
Mm-hmm.
Okay. How do we make sure that there aren't overages in this? I know there's a clause in here that says, the not to exceed $1.5 million. But as we've seen with other sorts of these, this comes from worrying about how you come here often saying, well, they got us again. We have to do this because the mainframe is essential to county operations.
So yeah, if we have to extend the mainframe, it's because we don't have the new system. So it won't be an overage. It's in our existing budget.
Okay. Okay. Thanks.
Anybody else? Seeing none, let's go ahead and prompt the vote.
You have 7 yeas, 0 nays.
Okay, motion
All right.
carries.
Thank you, commissioners.
Thank you, Mr. Tim. Next up, we have item 10B, approval to waive the interest and fees for certain qualifying taxpayers from March 1st to April 30th, 2022. Moved by Commissioner Kowal, supported by Commissioner Moss. Good morning, Mr. Wittenberg, Treasurer of Oakland County.
Good morning, everyone. How are you all doing?
Good.
Okay.
How are you?
See you. Good. It's nice to see all of you on this little box here. I see you waving. Thank you. So, as Mike Tim was saying, it is still January, and some of you I haven't seen. So Happy New Year to those that I haven't seen, and hopefully 2022 will be a great year for all of us and all of the residents of Oakland County. So this is a resolution that we do every year. We do it annually, and it comes before your committee. This is the first time I'm doing it, obviously, but this is something we have to do under the General Property Tax Act. Every March 1st, any property, this is probably something that you're all familiar with, but just to go over it, any property taxes that are unpaid to the local taxing units are turned over to our office for collection. Included are the summer tax deferments approved by the local government for a select group of individuals, which is defined in statute. So seniors, veterans, and disabled members of our community who are on fixed incomes and require their income tax return to be, they use their income tax return to pay the previous year's taxes. So this resolution just requests 2 months. So it's March and April to continue to defer their taxes and then waive the fees and the 1% monthly interest that is added by the treasurer, per law, per the General Property Tax Act. And notification of this waiver is provided on all summer and winter tax bills, on local treasurer websites, and in their newsletters. And our office also promotes through our taxpayer assistance meetings and annually with this resolution as we go through it. So it's something we do year in, year out, and just coming before you again for approval. And happy to answer any questions that you have.
Thank you, Mr. Wittenberg. Commissioner Powell.
For individuals who, let me just say this, you name seniors, you name veterans, you name, just in those two, we do have an aging population. And I was wondering, for some of them that may not be accessible to the internet and things like that, what are other ways that they are being properly informed about this option? Or is this something that they already know about, be it the situation has occurred and they know that they have this right? I just was trying to figure out, how do even seniors or veterans who may come into a situation, how can they be notified or gain knowledge of this option that is kind of privy to them? And because we are in the modern day and we have an aging population, I just want to make sure that, we touching everybody and everybody know about this option, especially our seniors and our veterans.
I completely agree, and I appreciate that. The notification is provided on all of the summer and winter tax bills, so what they get. Okay. And the local treasurer puts it up. They're required to put it up on their website. Some put it in their newsletters. We, within our office, promote it as well, so it is going out there. Okay. But if you ever have thoughts of ways we can even do a better job, obviously I'm all ears. But as of now, it's put out there through the locals. Obviously, it's mostly through the locals, but we have these conversations with taxpayers when they reach out to our office as well.
Can I just make 2 suggestions? Sure. Is there, just moving forward, because I know you all are limited on your marketing bill as well. We have supposed to be a one-stop shop veterans department. Just make sure they're aware of this option. And then we all have senior liaisons for every district to make sure we share this information with our senior liaisons and our leadership here at the commission. I think Joanne probably can help you with that, just to pass along or email that information so they are aware of this, so that they can get it out to all our seniors, because that's one of their responsibilities, is making sure our seniors in our districts know what's going on. So if those 2 options you can entertain, that'd be great. That's just another way of us tapping into those 2 entities in our county.
Yep, I'm just making a note of it right now. So,
and it's just to email them, email the information. And then for the Veterans Department, they also can share with all the veterans that veteran organizations throughout our county. That I know that they buffed that list up when COVID came, because they were trying to help a lot of our veterans and the organization. So they can just forward that information by email too. So I just want us to spread the word as much as possible, try to help as many people as we can.
Yep.
Thank you.
I agree, and I appreciate that. Yeah, thank you.
All right. Commissioner Cavell.
Yeah. Hi, Robert. Just 2 quick questions for you. Roughly how many folks do you expect to take advantage of this, especially in light of the moratorium being lifted?
So, well, this is obviously So I kind of look at those two separate things, but the numbers, you look in the grand scheme of things and the population of Oakland County, the number is actually really small. The highest we've seen when we look at historical data here, the highest we've seen is just over 500 people for the county.
Okay.
So in 2020, there were 213 people that were eligible for the waiver, and 139 utilized it. So it is a really small percentage of the population, but obviously it's it is something, it's a resource that is available to them. So
Okay. And then
obviously we're pushing forward.
yeah, and then my second question is there any local flexibility in how we do this? In that, can we expand the definition of who qualifies or shorten or lengthen the timeline? Or since it's a state law, it's just what it is?
Yeah, this is state, because this is something we're going through the General Property Tax Act of the state. And so this is something that is provided there.
Okay, so we can't do anything with it locally. Okay, thanks.
Not that I'm familiar with. I'm happy to kind of look into it and see, but based on this is state law. I don't know if they give local communities any kind of flexibility with it. I don't think so, but I will see.
Thanks.
Yep. Thank you, Commissioner Cabell.
Commissioner Moss.
Yeah, thanks. I looked, I didn't see. I may have missed it. What's the dollar amount of this cost? Or isn't it any? Because they weren't going to pay it anyway.
Well, so this is them. They are paying their taxes. So this isn't actually giving anyone a tax break. This is, in essence, just giving them 2 extra months to be able to pay their taxes, right? So because ultimately their local taxes are due to their local community by the end of February. And then, as you know, everything that's delinquent is turned over to us to collect.
Yeah.
And then per state law, right, there's interest that is added, there are fees that are added. This, in essence, is just waiving it for March and April for people that can utilize their tax returns to pay it off. So this actually ultimately, this isn't, if you look at it like this, right, we're not forgiving anyone's taxes. We are just giving them a 2-month extension to be able to pay their taxes utilizing their tax return. And the dollar amount, I don't think you missed it because I'm not sure it was in there, but I think, let me pull it up here. The dollar amount was just about $7,000 total in 2020 of fees and interest that were waived. So, it is negligible, the amount. But again, they still owe the taxes. We are just giving them a longer window to pay it. And this gives us the ability to waive or delay those fees, if you will, for that 2-month period. We can't actually waive them. We delay them. And if they pay within that window, then they aren't assessed those fees and interest.
Yeah, we're waiving the fees, exactly. And how much is it going to cost? And you said about $7,000, and I think that's a good, that's fine. And yeah, it works for me. I just like to see that money, that sum put up front. And I think actually that's something to brag about. If for $7,000 or something, you can keep these people from losing their properties or whatever, I think that's money well, I won't say spent, but foregone. All right, thank you.
Yeah, absolutely. Thank you, Commissioner Moss.
Thank you. Anybody else have any questions or comments? If not, let's prompt the vote, please. All right.
We have 7 yeas, 0 nays.
Okay, motion carries. Thank you, Mr. Wittenberg. Have a good day.
Thank you all, you too. I'll see you all soon. Thanks so much.
All right, next up, we have our second public comment. If anyone cares to speak. Welcome again.
Thank you very much. This has actually been a very interesting meeting. Last couple have been interesting today, so I'm glad I was able to get the snow off my car and make it in here. So, I guess it's afternoon almost, so close enough. Good afternoon, commissioners. My name's Catherine Kennedy. I'm from Lake Orion, and I just had a couple of things I wanted to comment on that I was a little unclear in the meeting. With the 2 FEMA proposals, I believe 8E was the one that got approved, so it'd be either D or E. I'm pretty sure it was 8E. I'm hoping that isn't the one that was changed only for the undefined climate change. Literally, those were the only words in the document I saw that I did review. I did not have time to review this one to see if they were, which one, if either, correlate with the one I reviewed before. So that's one thing. And then the second thing, I really appreciate you talking about the property taxes. At a county level, I've had the occasion to deal with a problem with property taxes at the county level. I probably would have been in the lawsuit with all the people that lost their house, except I paid the over $6,000 they wanted to reassess me. And the only reason was, because this is an interesting reason, I owned the house from the very beginning. Later, I remarried and moved to the other house my husband already had, and my daughter stayed in the house. So there was no transfer of ownership whatsoever. However, because I moved in with my husband, they retroactively changed my property taxes 6 years after the fact for 3 years. So if you follow that, for 3 years, they got around to telling me 3 years later. So there were a lot of fees. It was over $6,000, as I recall. It was quite a few years ago, and it was at the time when my parents were in critical medical situations. So it didn't hit to the top. I just wrote the check. I did contact the state. I never got a notice from the state or the county that there was back taxes, number one. I never got an opportunity to challenge it, and when I called Lansing to follow up on it, they said, well, you got something in the mail you were supposed to send in. I said, well, no, I didn't get anything in the mail. I have no idea what you're referencing. If you could send it to me, I'd be glad to submit whatever it is you want. And so they said, no, they couldn't send that out. I was shocked. If I hadn't had so much chaos going in my personal life, I would have elevated it pretty high. The other thing is, I found out it was only based on whatever is photographed on the back of the closing package. There's a form that they do at the state level that explains the difference in the tax. Please let me finish. This is an important one for the entire state. The tax that is on the statement, if you look at the back side at a closing, it would have the instructions. I checked every single closing I had done, and I had checked all the way back to the 80s when it didn't exist before. There was not a single closing I had ever done, whether it was a purchase or refinancing, throughout that entire time that had that information that would have allowed me to know that it should have been changed because my daughter was there and I was no longer living there. There was no way to even know.
Ms. Kennedy, your 3 minutes are up.
Thank you for the extra time. I really think it's an important thing because anybody that pays property taxes in the state is charged an enormous amount in fees and interest, which should be reduced to begin with. Thank you.
Thank you. All right, public comment. Is there anyone else? Seeing no one, I will close public comment. Do we have any other business today? Commissioner Cavell.
Hi, I just wanted to bring up one thing I chatted with the chair about is, as it relates to Wellpath, maybe adding an amendment to that, also sidebarred with the sheriff's office while they were here, an amendment to have the board staff undergo a feasibility study of what the cost would be if we were to move the nursing, healthcare, dental services back in-house, just to see what that cost would look like. Not to change anything for the Wellpath contract and to go forward with that, yes, but to just get a cost estimate and do that within the next couple months.
Conduct this study?
Board of Commissioners staff.
We would conduct it?
Yeah. So just getting
You and I
thoughts.
would conduct it, or we would conduct it? Or staff would conduct it?
Staff would conduct
Staff
it.
would conduct it.
Yeah.
So you can make that proposal and have it brought through the committee process to see if that's something we would want to do.
Okay, I mean, as an amendment to the Wellpath. So to people, just throwing that out there. We can talk later and think about it.
We already just passed the Wellpath.
Yeah,
piece
and then
of
we
it.
have to pass it at the full board meeting, and so it could be an amendment there.
You can amend what you want.
Yeah, just getting people's vibes and temperature.
Vibes.
Yeah, okay. Also to what Ms.
Okay.
Kennedy just said, I'm also talking with GMAR, the Realtors Association, about changing the property tax disclosures, because when people buy a house, there's that pop-up that people aren't aware of. So especially in Chuck and I's area, people buy their house and then a year and a half later, they realize their taxes have doubled or tripled. And so if anyone wants to be a part of that, please reach out.
All right, anybody else with other business? Seeing none, I will call the meeting adjourned at 12 noon exactly. Thanks, everybody, for coming.
Sorry, Charlie, my phone call.